Hi, I am Dr. Shevchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire. And I do get asked a number of times questions about dental crowns, and I am going to be answering some of those questions for you. Dental crowns are just think of like almost like a helmet around a tooth. It covers a tooth 360 degrees all around. And it's basically a restoration which helps restore the tooth structure back. Let's say if somebody had fractured tooth, you had a big filling and it broke off, or somebody had a big cavity that had to be taken out, or somebody had a root canal treatment. So it basically helps to restore the function of your tooth back so you could continue to use your tooth. Some of the alternatives could be not as great, could be that doing a very big filling on a tooth. That's pretty much basically it. One of the most common ones today is a tooth color material matching crowns, which we also call them ceramic crowns. They are made of material which is tooth color, and there are many different colors. Obviously, patients have different colors of their teeth, so we have the ability to match those colors. So when you have the crown, nobody actually even knows that you have a dental crown in your mouth. The other crown is where two different kind of materials. There's a metal underneath, and there's the layering of what we call a porcelain on top of it. And the other type of crown is a pure gold crown, which look like actually gold crown. It's a combination of different metals, but we call it a dental gold crown. So dental crown is necessary most of the times after getting a root canal treatment. The reason is that after getting a root canal treatment, the nerve is taken out. So there is pretty much no nerve supply to your tooth. So tooth becomes brittle over time. So if the tooth is in function, we want to make sure that the strength is there and you're able to use your tooth even years after you get the root canal done. So putting a dental crown after getting a root canal on the tooth helps you maintain the tooth for a much longer time. So the dental crown procedure could be a two-step process, and there are multiple little steps involved in it. So let's say you're getting a dental crown done, so your dentist will get you in the chair, and we are basically trying to shape off your tooth so you're able to receive the crown on top of the tooth. So, you get numb, the shade is taken, we take a little replica of the tooth, we are able to get you what is called a provisional crown or a temporary crown that you will be wearing. In the meantime, the lab is fabricating your final crown. You will be getting anesthetized, taking the matrix, taking the color, and working on to shaping the tooth, and then either doing a scan, 3D digital scan, or taking a final, what we call it, a final impression of the tooth, and then making you a temporary crown, putting it on, checking, making sure you're biting well, you're able to floss well while you're using your temporary crown. And the process, the lab is fabricating your permanent crown. And that's pretty much it. And then you go home, and next visit when you come in, that temporary crown is taken out, your tooth is cleaned up, and then putting the permanent crown on, making sure, taking an x-ray, make sure that it fits well. All the check boxes are covered. Our checklist is done in terms of that the crown is fitting well. You're able to floss after, you're able to bite well after, and we use a permanent cement to put that crown on, and you have your crown. So the dental crown placement does not hurt, and it should not hurt, because you want to make sure when you're getting your crown done, you're fully anesthetized. We have those tools available to us where we are able to get you fully numb, so you should not be feeling anything when you're getting a dental crown done. So there are no per se bad consequences of getting a tooth crown done, because the reason you're getting a crown done is so that you can enhance the life of your tooth. So it is there, it's needed so that you can, your tooth can function. You have the tooth for longer period of time in your mouth. So, the only thing is that, sometimes patients may have some sensitivity after because the tooth is shaped around. But overall, on the long term, no bad consequences there. Is it worth putting children's teeth in crowns? Yes, if they are needed. Again, as we talked before, the reason that they might be needing a crown is even though it's a baby tooth or it's an adult tooth in children's mouth, is the reason they are needing is because for one of the reasons they have lost their natural tooth structure. The reason could be it broke off accidentally. It could break off if somebody fell down or playing sports or any other injury. Or there was a big cavity on the tooth and there's not enough tooth structure to support for the tooth to stay itself. So that is the reason that those could be some of the reasons where you might need a crown in children's mouth. So if it's needed and it's going to help maintain the tooth and restore the tooth to function well and stay in your mouth longer, yes, if it's needed restoration, it is good to do it. Yes, the crowns do look like normal teeth, especially nowadays with all the technology we have available. We are able to match the shape, the color of, if you're getting just one crown, we are able to match the shape and the color of the crown that are neighboring to those. So yes, they do look really well. Cavities can happen on crown teeth. The area where they could happen underneath the crown, or most of the time they do start along the gum line because that is where the bacteria can get entry. Rest of the crown is sitting on the tooth. And also if there was any, cavity maybe left behind or the bacteria gained entry through some of the openings around it, then it can get a cavity. So how long can you expect a dental crown to last? They can last 20, 30, 40 years. The reason why they would last or they would not last is basically how well they are being taken care of. Actually, even starting back, like if they're done really well and you're taking really good care of them, you're maintaining your, hygiene at home, you're brushing, flossing as twice a day, and also you're maintaining your regular dental visits so your dentist can check it up on it, so they can last you a lifetime. So does insurance cover dental crowns? It really depends on what kind of dental insurance you have. There are many different dental plans that are out there, and there are many different, there could be different restrictions. It's really based on your policy, but in general, if your policy has that coverage, yes, they can be covered. So how can you schedule an appointment to get a crown is, very first thing is that you will, obviously call our office, and you will have to see, either myself, or my associate doctor. So you want to get an evaluation done by the dentist. They will take an x-ray, check it out. Okay, this is the actual treatment that you need. And from there on, we will explain you the procedure and the outcome of it. And then you get an appointment scheduled for it. I hope I was able to answer most of your questions on dental crowns. If you have any other questions, you can give us a call. And the number to call is 603-926-8827, and I would be happy to see you in our office and help you out with that need.